Every 40 seconds, someone in America has a heart attack. And here is the part that should stop you cold. Nearly half of those people had warning signs days or even weeks before it happened. They felt something. They noticed something. And they told themselves it was nothing. If you are watching this video, there is a chance your body is trying to tell you something right now. In the next few minutes, I am going to show you 5 specific warning signs that appear before a heart attack. Signs that are routinely missed, routinely dismissed, and routinely regretted. Stay until the end, because the last 2 may be the most dangerous ones you have never heard of. My name is Dr. Kevin Attawale, and for over 2 decades I have worked as a cardiologist with real patients. People exactly like you. People who came to me not after their first warning sign, but after their second one, because they ignored the first. I have reviewed thousands of clinical cases, studied the research in journals like the New England Journal of Medicine, and spent years translating what the science actually says into language that helps people protect their lives. I'm not here to frighten you. I am here to make sure you are never caught off guard. Here is something your doctor may not have time to tell you in a standard 10-minute appointment. The heart does not fail suddenly. It sends signals, quiet, easy to dismiss signals, sometimes weeks before the actual event. The problem is that after the age of 60, your body's internal warning system works differently than it did at 40. Here is why this matters biologically. As we age, the baroreceptors, tiny pressure sensors inside your blood vessels, become less sensitive. Think of them like smoke detectors that have had their batteries slowly draining for years. They still work, but they do not scream as loudly as they once did. That means the pain, the pressure, the discomfort that would have sent a 40-year-old straight to the emergency room might feel, to you at this stage of life, like indigestion, like a pulled muscle, like a bad night of sleep. According to the American Heart Association, women and adults over 65 are significantly more likely to experience what researchers call atypical heart attack symptoms, meaning the classic Hollywood chest grab is often not what they feel at all. And because those symptoms do not match the picture we have all been shown, people wait. They wait until it is too late. I have also spent considerable time reviewing the research behind Dr. Matthew Walker's landmark work, Why We Sleep, and what he reveals about the cardiovascular risk window between 2 in the morning and 6 in the morning should be required reading for every person with a heart condition. We are going to get to that. But first, the 5 warning signs. And I want you to share this with someone you love before this video is over, because this information could change everything. Item 1. The silent squeeze. Most people skip this one and regret it. You have been told that a heart attack always announces itself with crushing chest pain. Here is what the research actually shows. For people over 60, and especially for women, one of the most common pre-attack warning signs is a dull, pressure-like heaviness in the chest that comes and goes. Not sharp, not dramatic, just a quiet, aching squeeze that lasts anywhere from a few minutes to 20. Here is the biological mechanism behind it. When arterial plaque begins to restrict blood flow, the myocardium, your heart muscle, experiences what cardiologists call intermittent ischemia. That is a fancy way of saying your heart is not getting enough oxygen in short bursts, and it responds by sending a low-grade distress signal through the vagus nerve. Your brain interprets that signal not as emergency pain, but as vague discomfort, because your baroreceptors, as I mentioned, are less sensitive at this stage of life. The signal is real, the heart is struggling, but the sensation feels manageable, so you manage it. And that is the danger. As Harrison's Principles of Internal Medicine notes, ischemic episodes that precede a major cardiac event often go unreported because patients attribute them to musculoskeletal causes. Your practical step: if you feel any unexplained pressure or heaviness in your chest, even mild, that lasts more than 3 minutes and has no obvious cause like physical strain, note the time, sit down, and call your doctor the same day. Do not wait for it to get worse. Item 2. The jaw and left shoulder betrayal. I have seen this send 3 patients to the ER in 1 month. You have been told that heart attack pain stays in the chest. Here is what the research actually shows. Referred pain that travels to the jaw, the left shoulder, the left arm, or even the upper back is one of the most documented and most ignored pre-attack symptoms in existence, particularly in people over 60. The mechanism is called viscerosomatic convergence. Your heart and your arm share the same spinal nerve pathways, specifically the C8 to T4 dermatomes. When your heart is under oxygen stress, the distress signals travel those shared nerve highways, and your brain literally cannot tell where the pain is coming from. So it guesses. It sends the sensation to your jaw, to your shoulder, to your arm. You think you slept wrong. You think it is your old rotator cuff injury acting up. You take a painkiller and go back to bed. Dr. Joel Fuhrman makes a powerful point in Eat to Live about how years of dietary-driven plaque accumulation silently narrows the coronary arteries long before symptoms appear. And when referred pain finally shows up, it means that narrowing has become critical. Your practical step. If you experience unexplained jaw ache, left shoulder soreness, or inner left arm heaviness that appears without physical cause and disappears after a few minutes of rest, treat it as a cardiac signal until proven otherwise. Call your doctor. Do not self-diagnose it as a muscle issue. Before I get to number 3, this one surprises almost every single patient I share it with, and I need you to stay with me, because numbers 4 and 5 are the ones that happen while you are asleep, and they are the ones most likely to go completely unnoticed until it is too late. If you have grandchildren you want to be around for, if you want to stay independent and in your own home, do not click away. What is coming next could genuinely save your life. Item 3, the 2 a.m. cortisol bomb. Number 3 is the one cardiologists argue about most. You have been told that sleep is when your heart rests. Here is what the research actually shows. Between 2 in the morning and 6 in the morning, your body triggers a natural surge of cortisol to prepare you for waking. For most people, this is normal. For people with arterial disease, high blood pressure, or undiagnosed sleep apnea, this cortisol surge acts like throwing gasoline on a smoldering fire. Here is the biological mechanism. Cortisol triggers the release of catecholamines, adrenaline, and noradrenaline, which cause your blood vessels to constrict and your heart rate to spike. Simultaneously, a process called platelet aggregation increases, meaning your blood becomes more prone to clotting in the early morning hours. The New England Journal of Medicine published landmark research showing that the peak incidence of sudden cardiac death and non-fatal heart attacks occurs between 6 and noon, directly following this cortisol-driven window. Dr. Matthew Walker, in Why We Sleep, documents this same risk window and explains that people with untreated sleep apnea experience repeated cortisol spikes throughout the night, not just once, effectively putting their cardiovascular system through a stress test every few hours while they are unconscious. This is what we call nocturnal hypertension, blood pressure that rises dangerously at night while you sleep, never showing up on a daytime reading at your doctor's office. You could have a perfectly normal blood pressure at 2 in the afternoon and a critically dangerous one at 3 in the morning. Your practical step. Ask your doctor specifically about nocturnal blood pressure monitoring and get screened for sleep apnea. If your partner says you snore heavily or stop breathing at night, do not dismiss that. That is your warning sign. Item 4. The breathless lie. Most people skip this one and regret it. You have been told that shortness of breath is a lung problem. Here is what the research actually shows. Unexplained shortness of breath during mild activity, or even while lying flat in bed, is one of the most consistent pre-heart attack signals in adults over 60, and it is almost universally attributed to something else first. The mechanism is called pulmonary venous congestion. When the left ventricle of your heart begins to weaken or struggle, it cannot pump blood forward efficiently. Blood backs up into the pulmonary veins, the vessels that carry oxygen from your lungs to your heart. Fluid begins to seep into the lung tissue itself. Breathing becomes harder, especially when you lie down, because gravity is no longer helping drain that fluid. You feel short of breath climbing the stairs. You feel it walking to the mailbox. You feel it lying flat, and you learn to prop yourself up on 2 or 3 pillows without even realizing why. In clinical cardiology, sleeping with extra pillows to breathe more comfortably has a specific name, orthopnea, and it is a documented sign of worsening heart function. Dr. Michael Greger details in How Not to Die how dietary choices, specifically foods high in trimethylamine N-oxide, or TMAO, a compound produced when you digest red meat and certain processed foods, accelerate the arterial and ventricular damage that leads precisely to this kind of left ventricular dysfunction. TMAO is produced in your gut when bacteria break down the carnitine in red meat and the choline in processed foods, and it drives plaque formation and inflammation directly in your heart muscle. Beef, processed deli meats, and eggs are the primary dietary sources. Your practical step. If you notice you are getting short of breath during activities that did not tire you before, or if you have started sleeping on more pillows without knowing why, mention this to your doctor at your very next visit. Describe it exactly as I just did. Use the word orthopnea. It will get their attention. Item 5. The fatigue that fooled everyone. I have seen this send patients to the ER in 1 month, and every single one of them told me the same thing. They thought they were just getting old. You have been told that extreme tiredness is a normal part of aging. Here is what the research actually shows. A sudden, unexplained, crushing fatigue that appears without a clear reason, particularly in the weeks leading up to a cardiac event, is one of the most reported symptoms in post-event patient interviews. Women reported at nearly 3 times the rate of men, and nearly all of them dismissed it because they assumed it was age. The biological mechanism is mitochondrial dysfunction under ischemic stress. Your mitochondria, the tiny energy-producing engines inside every cell in your body, require a continuous supply of oxygen to generate ATP, which is the fuel your body runs on. When coronary blood flow is compromised even partially, the mitochondria in your heart muscle begin failing to produce enough energy to sustain normal function. Your body compensates by redirecting blood toward your vital organs and away from your muscles and brain. The result is a bone-deep exhaustion that sleep does not fix, because the problem is not tiredness. It is oxygen deprivation at the cellular level. Dr. David Sinclair, in Lifespan, documents how mitochondrial efficiency declines with age and how cardiovascular stress accelerates that decline, creating a feedback loop where a struggling heart makes the body more exhausted, and an exhausted body is less able to signal or respond to cardiac distress. Your practical step: if you experience a sudden and significant increase in fatigue, not the tired you feel after a long day, but a heavy, unshakable exhaustion that lasts for days without cause, do not attribute it to age. Get a full cardiac workup that includes an echocardiogram and a stress test. At this stage of life, this symptom deserves to be taken seriously. Now here is the good news. Every one of these risks is completely preventable once you know what to do. I want to give you something you can start using tonight. I call it the Heart-Safe Bedtime Routine, a 5-step evening protocol designed specifically for people over 60 who want to reduce their cardiac risk during that dangerous 2 a.m., 6 a.m. window and wake up with a heart that is working for them, not against them. Step 1. Finish your last meal at least 3 hours before bed. Eating late forces your body to digest while lying down, which raises blood pressure and triggers acid reflux that can mimic and mask cardiac symptoms. Give your body time to finish that work before you sleep. Step 2. Take a 15-minute slow walk after dinner. Not a workout, a walk. This helps lower post-meal blood glucose, reduces overnight cortisol baseline, and, as Dr. Michael Greger explains in How Not to Die, measurably improves nighttime cardiovascular function, even in people with existing heart disease. Step 3. Cut sodium after 6 p.m. Sodium consumed in the evening is the single biggest driver of nocturnal hypertension. That means no canned soups, no processed crackers, no deli meats, no soy sauce after dinner. Read the label on everything. Sodium hides in places you would never expect. Step 4. Sleep in a cool, dark room between 7 and 8 hours. Dr. Matthew Walker's research in Why We Sleep establishes clearly that sleeping fewer than 6 hours dramatically increases the risk of a cardiac event, and that temperature-regulated deep sleep is when your heart rate naturally dips to its lowest, most restorative level. Protect that window. Step 5. Tell someone in your home your symptoms. This is the one people skip. If you have noticed any of the 5 warning signs I described today, the chest heaviness, the jaw ache, the morning breathlessness, the unusual fatigue, write them down tonight and share them with your spouse, your child, your caregiver. The years ahead are meant to be lived fully. Your grandchildren need you present, independent, and well. Do not carry this information alone. Now I want to hear from you. Which of these 5 warning signs surprised you the most? Drop your answer in the comments right now. I read every single one, and your comment could help someone else who is watching this video and needs to hear it. If this video gave you value today, please share it with someone you love, a parent, a sibling, a close friend, anyone whose health matters to you. One share from you could genuinely save a life. And if you are not subscribed yet, hit that subscribe button right now. I publish new health insights every single week, the kind of information your doctor may not have time to explain in a 10-minute appointment. You deserve to know this. Medical disclaimer. The information shared in this video is strictly for educational and informational purposes only. It does not constitute medical advice and should not replace the guidance of your qualified physician. Always consult your doctor before making any changes to your health or medication routine.